Hi, my name is Emily Bladen, and I'm from Frostburg State University. This presentation is going to be about cerebral vascular accident, otherwise known as stroke. The purpose of this assignment is to educate the community on the risk factors and primary prevention of cerebrovascular accidents. So let's begin by talking about the history of strokes. Stroke wasn't always called a stroke. Before, it was called apoplexy. When strokes were first noticed 2,400 years ago, stroke was called apoplexy, which literally means to be struck down by violence in Greek. This term is very appropriate for stroke. When a stroke occurs, part of the brain loses its function, causing the rest of the body to kind of have a violent action. In 1928, apoplexy was divided into categories based on the cause of blood vessel problems. This led to the common terms now known as cerebral vascular accident and stroke. Stroke is now often referred to as brain attack, to denote the fact that this is caused by a lack of blood supply to the brain, very much like a heart attack is caused by a lack of blood supply to the heart. Brain attack also reiterates the fact that since it's an attack, it is an emergent situation. So continuing with the history of strokes, Jacob Weffner, born in 1920 to 1995, was the first physician to recognize this phenomenon as a bleed or block. In 1664, Thomas Willis published the book Cerebrae Anatomy, which this introduced the word of neurology, which opened up a whole different chapter to what's really going on in our brains. This also introduced the circle of Willis. As you can see here, the circle of Willis is demonstrated by the main arteries and vessels that supply the nutrients to the surrounding areas of the brain. Here are some images from the book that Thomas Willis produced. Again, it shows the paths of how the nutrients travel into what different areas of the brain. This was a big phenomenon in neurology, and many of the neurologists still use it today. So let's talk about the different types of strokes now. There are two different kinds of cerebrovascular accidents that occur. Mainly it's either hemorrhagic or ischemic. The hemorrhagic stroke occurs when a diseased blood vessel within the brain bursts, allowing blood to leak inside of the brain. This causes an increase of pressure within the brain. And with an increased pressure on the brain, it can cause deficits, coma, or death. Having any kind of a stroke is a medical emergency, both hemorrhagic and ischemic. As we can see with hemorrhagic, it's a big deal because the bleed needs to be stopped somehow so death doesn't occur. The longer you wait, the more deficits or less likely chances of waking up would be. In an ischemic stroke, it occurs when an artery to the brain is blocked. Without the nutrients from the blood, the artery will eventually stop working. So in the circle of Willis that we saw, if one of those arteries blocked, a big area of the brain wouldn't have any more to function. And just like many things in the body, if you don't use it, you lose it. Just like the brain, you wouldn't be able to use that function anymore. The longer without the nutrients, the higher the risk for brain cells to die and never regain function. Here's some statistics about strokes. Stroke is the third leading cause of death in the United States. More than 140,000 people die each year from stroke in the United States. This is a tremendously large amount of people who are dying from stroke, which, if educated and monitored right, it could possibly be prevented. Stroke is the leading cause of serious long-term disability in the United States. Not everybody dies from a stroke, but many of the people who suffer from a stroke have the long-term disabilities. Strokes can and do occur at any age. Nearly 1/4 of strokes occur in people under the age of 65. I personally work in Baltimore City, and I can vouch and say that many of the patients we get with strokes vary in age. Some of them as young as in their 30s, all the way to as old as their 90s. Stroke doesn't always care about the age. On average, someone in the United States has a stroke every 40 seconds. So during this presentation, by this time, there's been a handful of people who have had a stroke in the United States. Atrial fibrillation, AFib. AFib is a condition of the heart where the blood isn't pumping effectively. It kind of causes a stasis, so like a holdup in the heart. And when the heart does get that good effective pump, it could send a blood clot because it was just being stationary. Given the circulation of the heart, when that clot is thrown from the heart, it can go straight to the brain, resulting in an ischemic stroke. So if a person has atrial fibrillation, it is an independent risk factor for stroke, and it increases the risk about 5-fold. High blood pressure is the most important risk factor for stroke. We know that high blood pressure can be managed and modified with diet, exercise, medications, and so on. Stroke is the number 3 cause of death in Baltimore City. Here we have a map of Maryland. This map signifies the average age-adjusted death rate per 100,000 population. The white areas are the rates that are significantly lower than Maryland's average death rate of strokes. The yellow rate is about the same average of Maryland, and the dark green yellow area is the rate that is significantly higher than Maryland's average of death-related strokes. As we can see, Baltimore City is one of the 2 areas that are shown to have the higher average. The other area is Carroll County. Right now, I'm currently working in Baltimore City and see the death rates and how strokes affect the population very significantly. And when I'm not at work and I'm at home, I'm right here in Carroll County, which, as you can see, is affected by stroke. So what are the symptoms of a stroke? FAST is the very well-known acronym about a stroke, but it's not known well enough. People need to understand what each of the F, A, S, and T stands for and able to save their brain. So first, F is for face, otherwise known as the facial droop. If one side of the mouth is showing to be a little bit more lopsided or weaker than the other, that's a sure sign that something's going on in your brain and you need to seek immediate help. Second would be A for arm weakness. If one arm is weaker than the other, or if it's having some decreased sensation, numbness, or tingling, any abnormality, it's very important to get that checked out immediately because that could be some sign of brain damage. Next, we have speech. If you're having slurred speech, difficulty talking, difficulty swallowing or drinking, that is another sign of stroke. It's important to recognize this risk factor because it can cause aspiration and amongst other things in addition to the stroke. And finally, T is for time to call 911. This could be the most important factor of all of these. If you have the facial droop, arm weakness, and slurred speech, but don't understand that you gotta seek medical help immediately, then this acronym will be pointless. It's very important to understand that time is the most crucial part of this, and you need to act fast when you're having a stroke. It's very important to act as quickly as you can if someone is experiencing any of the previous symptoms. That's both in yourself or in someone that you see. So some benefits of quick recognition. Well, time is brain. The longer you wait, the more deficits that can occur. If you have quick recognition, it can increase the chances for the person to receive TPA. TPA is a drug that can be given in a stroke center hospital that is otherwise known as a miracle drug. This drug saves lives ultimately. It pretty much reverses the effects of an ischemic stroke that they're having by breaking the clot. Before the TPA, the healthcare professionals have to get imaging, coagulation studies, and see if they're a good candidate for TPA, but it's very worth it if they can get to the hospital quick enough. The TPA window is about 3.5 to 4.5 hour time period that the person can receive it from the onset of stroke symptoms. Having a quick recognition increases the chances for optimal outcome. The risk of delayed recognition is lifelong deficits, death, longer hospitalizations, longer physical, occupational, and speech therapies that the person would have to do. When you're taking these symptoms into consideration, you have to think that it's not only the patient that's going to be affected, but the family members as well. It's going to be heavy on their financially, emotionally, and of course physically straining to have to be able to make up for the person's new deficits. Risk factors. What puts you at risk of having a stroke? The non-modifiable risk factors are risk factors that you cannot change. So first, we know we can't change how we age, but the increase of age causes you more at risk to have a stroke. Gender, race. Stroke deaths are the higher for African Americans than for whites, even at younger ages. Ethnicity, family history, previous stroke, that puts you at a huge risk of having another stroke, and certain diseases. I'll talk a little bit more about diseases because some of the diseases, though you have them, they can be managed and controlled and therefore lower your risk of a stroke. The modifiable risk factors are the risk factors that you can change and help decrease your risk of having a stroke. Smoking. The risk for ischemic stroke in current smokers is about double that of non-smokers after adjustment for other risk factors. Diet. Along with diet, you have obesity, location of where you're living, diabetes, atrial fibrillation, which we talked about previously, high blood pressure, and high cholesterol. So the diet, obesity, diabetes, high cholesterol, and high blood pressure can all be managed. Though you may be diagnosed with them, that means that you have a condition, but with correct exercise and diet and medication management, your vessels and arteries in your body can be well controlled and therefore lowering your risk of a stroke. This presentation is targeted towards anybody who can benefit from the information. Anybody can be at risk for a stroke, especially those non-modifiable risk factors that we talked about. This presentation is especially targeted towards individuals in Baltimore City. Due to their location, their race and ethnicity, and their lifestyles, they are a lot higher risk of developing a stroke. I hope that this program gives some information that people can take home with some actions to take to save their brain. So first, we need to know that there are some options of where you can get screened. Different facilities offer screenings that can be free or to low charge, where you can see how your carotid artery is to see if there's any kind of buildup there, which would be direct pathway to your brain. You can get your cholesterol checked or your blood pressure, which also shows the different levels of risk for your stroke, as well as your blood glucose level. It's important to monitor and modify the risk factors that you have realized are risk factors for you for stroke. That way you can change them and pay attention to them. You need to talk to your doctor to decrease your risk. Once you have a stroke, chances are it's too late to do anything about it. And then, like I mentioned before, your chances of having another one is a lot higher. So talk to your doctor about preventing an initial one and saving you and your family a bunch of strain. Raise stroke awareness. Other people need to know about the risk factors of having a stroke or what the signs and symptoms look like. If someone, or if you are, experiencing a stroke and have that slurred speech and difficulty getting your voice out, then you won't know to tell somebody it's time to call 911. But if someone else can recognize that you're having those stroke symptoms, then it can save your life. And finally, you need to take care of your brain. After all, you only get one. Unlike your lungs, kidneys, and heart, you can't have a brain transplant. That's too much of the functioning going on, and it's the control house of your body. Without your brain function, how enjoyable would your life be? Your brain takes care of every single thing that you do, from when you wake up in the morning till you go to bed at night and while you're sleeping. So make sure that you take care of your brain, and make sure that you are doing things to decrease the risk factors of having a stroke, and make sure that you're aware of what a stroke is and what the signs and symptoms are. Thank you very much, and here are my references of my work.